All right, so I want to hear your opinion on this. I've been working with a patient for a while now, and the blood pressure has been elevated since day one. I've noticed it has been a trend for a while now. But when I met them, I ordered some blood pressure medication, some cholesterol medication, started on some insulin and a ton of things because everything was just out of range. They have started the insulin, which is good, but all the other medications, they have refused to take it. They say they are using natural remedies. One thing that they're big on is the garlic. They say the garlic is what is going to be helping with the blood pressure. They've been using it for years and they're not going to be switching. Educated them on the importance, the benefits, the risk associated with everything that they're doing, and they're still with that. The garlic is what they're using. It so ended up that, the patient got into the hospital, had a stroke, went into rehab, got discharged. I thought that would have been like a wake-up call for them, but instead, we're back at square one. Every month I go and I see this patient and it's the same thing. How do you deal with a patient like that and a family like that where they are just wanting to do the natural, the natural route, the natural remedy for things? Blood pressure is still elevated and I don't know what else to do. I went over there and as I said, the blood pressure is still in the 160s, 90s, and they're saying that we're continuing with the garlic. Prescription is still at the pharmacy. They're not taking it, and it is what it is. So I said, okay, then, well, continue with the garlic, ma'am, because I really know what else to say. How do you deal with something like that? Put it in the comment box below, because I don't know if I was wrong to say continue with the garlic, or I don't know. Go ahead and just tell me in the comment box what you would have done as a nurse practitioner. Because as I say, I've been preaching. I feel as though I have been preaching every month about the importance of the medication, and it's not going anywhere. It's not going anywhere. The patient is saying she don't want it. The relative is saying that they're going the same, the same route in terms of the natural remedies, the natural route, and they have a ton of different natural things that they're taking. I don't know. I really don't know how to deal with the situation, because they fired a lot of persons before, and they said that, well, if you're going to keep on ordering all of these medications, you're going to get fired as well. So, we're upon a borderline with them right now. They walk on chalk line. But what would you do in this situation? That's what I deal with on a daily basis. Not every day, someday. You have patients like these. Other patients, they definitely want to take all the medications that you want. And that is just it. But go ahead and share what you would have done or what your thoughts are on this.